we've got cold and flu season coming up.
Yeah.
And my understanding is some of these symptoms are similar.
Yeah, that's a good one. That's a deal breaker. It's hard. It's a hard answer to give because a lot of the symptoms are similar, and 80% of the people that get infected with COVID have very mild symptoms. But it's challenging, and what we've done is really try to ramp up our testing capabilities and be able to test the combination of different viruses that are very common this time of year. So influenza and now COVID, and also RSV, which often affects little kids or immunocompromised people. But the symptoms are difficult to, parse through. I think that, they present very similarly. And, influenza can certainly be very, very risky and deadly to the right patient, but they can present almost in the exact same way. But the good thing is a lot of what we're doing already as a public health measure by distancing and masking could help decrease those risks. And also immunization and vaccines with the flu shot every year, I think that we could potentially try to decrease that risk, but it could really be a big burden on the healthcare, our bed capacity, I should say, the healthcare capacity, if we really have a bad influenza season.
I guess if I start feeling like oftentimes I do around this time or in a month, like I've got the flu or just a cold or something. I mean, should I go in? Should I just wait and see how things go? I mean, if my kids are like that, I mean,
Yeah.
I don't know how to handle that.
No, that's a fair question. And I think that we've done our best to prep for this. And I think that one of the positives of the pandemic is we've become really good at telehealth and video health. I think, a simple video visit to kind of go through your symptoms with your primary care physician or provider could be very beneficial. And if they feel like a test is necessary, there are really rapid ways to go in and get tested. It's challenging to differentiate the symptoms. A fever and a cough could be COVID. It could be a different coronavirus, or it could be influenza, and it's challenging to really know. And this year, more than ever, it's probably a time where we're going to want to get you in and get you tested the best that we can. I think this is the year where we can help talk you through it. And the primary physician and provider community has really done a wonderful job of trying to ramp up their care and get those video and telehealth visits in. And the nursing lines at different healthcare organizations can help you. But if you're not sure, just call. And we can get you tested, or even if you're unsure, you can always call the Department of Public Health too, and they can help get you to the right person.
A couple more questions. One question I had on my social page was from someone who's a labor and delivery nurse who wanted to know if there's any more information about, say, a woman who's pregnant who gets tested and has COVID. I mean, do we know yet, or is it still too early to know the implications of what that may mean for her, but also baby?
Yeah, we're still learning. I think we know a lot more than what we did in January, but we haven't seen as much, I guess, as we'd anticipate of severity. But there's certainly risks, and so what we've suggested as a public health community is just try to do your best if you're pregnant or planning on getting pregnant to try to decrease those risks of exposure by really masking and trying not to go out and decrease your number of people that you're exposed to on a day-to-day basis the best that you can. But there are cases, and at the time, like while you're pregnant, we haven't seen a lot of detrimental effects to the fetus. We don't think that it can necessarily be passed to the fetus within in utero, but at the time of delivery, we've seen a lot of women come in and have COVID either asymptomatically, that they're screened on admission, or they've come in with symptoms. And there's a lot of things that we can do to try to decrease the risk to the newborn, and also the healthcare workers. Your friend is a labor and delivery nurse, but there's also a lot of things that they can do to protect themselves and their baby, even if they're positive. The risk to the neonate is pretty little. And we've learned a lot that just, even if you're breastfeeding, there's a limited risk of passing the virus on to a baby, as long as if you're symptomatic, you're wearing a mask and washing your hands, or if you're expressing breast milk, you can really have good pump hygiene for your breast milk expression machine, and really doing your best to just try to keep good measures that you should have in place when you're breastfeeding, but a little bit addition while you're symptomatic. And the risk is probably pretty low to the kid.
What about Halloween coming up? What are you telling people?
I got the question from a couple people in my neighborhood and some patients. I think you have to approach it sort of on a risk basis too, and where we're at as a community at the time of Halloween. We're still a couple weeks out and our numbers are rising at the moment. And so if we're getting to the point where maybe Wisconsin's at the moment, I would say I would do probably not a lot outside. I would probably try to stay inside and really decrease the risk. But with that being said, these kids and families have really had a hard year. And I think, a small win is a win, and mental health is really important right now. And there are ways that I think you could reduce your risk. The CDC is certainly taking the really cautious approach, which I commend them. And I think their main concern would be large groups of people going out and trick-or-treating, and maybe teen groups, or you see those kids that come to the door with a massive group of people. And really just trying to decrease that risk of maybe smaller groups or people that you've quarantined with during this whole time. And limiting your exposure, obviously, to the time on the porch, and wearing masks and hand hygiene the best that you can. Direct trick-or-treating is really frowned upon. I'm having a hard time wrapping my head around that. And I have a little guy who is not yet 2, so thank God I don't have to go trick-or-treating. But I think in our neighborhood, we've come up with a plan of trying to leave some bags of treats out for kids to pick, and have people be outside, weather permitting, and handing out treats if that's the goal. But really masking in addition to your Halloween mask. And really trying to take a cautious approach with crowds, and no basement parties like we talked about.
Darn it.
And I know in Minnesota we worry about that, where there's a lot of gyms that have these, I guess they call them trunk or treats or something, I'm learning now. But just really the crowds are what the issue is, and we've learned that the spread really is from close contact with people, and in indoor spaces, close contact with people that aren't masking and for long periods of time. And so outdoors is going to decrease that risk, but masks can help decrease that even more, and then the crowd size even more so. The risk of passing it on with candy wrappers and other things is probably pretty low. I certainly want people to be cautious and wash their hands, but I think that risk we've shown is pretty limited. It's hard. I don't have a good answer to.
I think that was a great answer. That helps me a ton. And I think it will help Jess too, because we're just trying to figure it out. And I just didn't, you don't want to do the wrong thing.
I know.
Because I don't want to be the one who's responsible for getting myself sick, or getting my parents sick, getting anyone sick. I don't want that on my conscience. But at the same time, it's like, if my kids can't do something, they're just going crazy. And like you said, it's a balance of emotional health and your physical health, and trying to meander that. And we're kind of making it up as we go along.
I think we all are. It's hard. I mean, I can tell you, I am going to pack little treats in baggies. I haven't quite decided, because I hate plastic, of how best to do this. So trying to find a way that will have a non-plastic approach. But one other thing that our community has done, and maybe this is like the one positive of the Nextdoor app that I can find, is they've taken polls and come up with ideas of trying to have the community come together, where we're going to have potentially like a little drive-by front porch decoration contest, and depending on where we're at as a pandemic, even maybe a drive-by costume contest, or send in pictures so that the kids can at least feel involved if we're really at a high rate of infection at that point, or transmission, I should say.
Yeah.
I get a lot of questions about testing, but when to test is really the question. And so the Department of Public Health is recommending that if you've had a high-risk exposure, so if you've been around someone that tested positive for COVID-19, for more than 15 minutes within 6 feet is technically like a high-risk exposure, particularly in an indoor setting. They usually recommend that you go in and get tested after about 5 to 7 days from that exposure, or at the time that you develop symptoms. And so that way we can contact trace anyone that person's been exposed to and try to really mitigate any other clusters or infections. The question I get asked a lot by the public is this antibody test to see, like, have I had it? When can I check for this? What does it mean? And unfortunately, it doesn't really mean a lot right now, because we just don't know what that antibody test, what it actually, infers. Do you have immunity if you were exposed? How long will that immunity last? It's really hard to know. And the testing isn't, quite where it should be yet. And so an antibody test really is only helpful from a public health perspective to see really the amount of potential infections that have been in a community. But just to see if you've had it, it's just not a good helpful test, and it's expensive and not perfect. And if you had a positive, it wouldn't really change your life. If you had a negative, it wouldn't change anything that you do.
Last question. What would you, if you had to drill it down, what would you want people to know?
Yeah, I think the biggest thing is that there's fatigue right now, and we get that, and people are sick of hearing about it, and I know that. I am too. But it's really important right now, because we're starting to see a rise in our community that right now is not a time to kind of give up and just sort of throw in the towel and start seeing your friends and having parties around the holidays. This is a really important time where we could decrease death. We've seen 200,000 deaths in the US, and we can prevent that by continuing to try to social distance the best that we can, try to remain sane the best that we can, and masking. It's real, it helps, and it's a real virus. It's not something that people have just sort of made to sound worse over time. It is truly a severe respiratory illness in 20% of people. And if we can help decrease that morbidity and mortality of that 20% of people that could get infected, and help your neighbor by just staying home or wearing a mask and really trying to limit your exposures, I think we should do that.